Hmm. And just looking forward and for future directions, are there any treatments or studies that you're excited about? Any areas of focus that you look forward to seeing researchers kind of pay attention to more when you think about treatment for this illness?
That's a good question. Um, I think something that would be important, you know, still, I mean, there's still so much that we don't know about the pathophysiology or just like why this disease comes about, what markers, what cytokines or molecules are implicated in the development of this disease. So we really literally only have three classes of drugs that we use plus NSAIDs. So I think something that I'd be looking forward to are just other agents that, target other molecules, that will help us to be able to treat this disease in persons who have like a multiple myriad of comorbidities. Again, I'd mentioned a problem that I run into very often is that person has, inflammatory bowel disease with axial spondyloarthritis, so I can't use this medicine, but the interleukin 17 inhibitors, but they also have X problems, so I can't use a TNF alpha inhibitor and I can't use a JAK inhibitor because of this. So I really love to see a greater, range of medicines that, we could use to treat this disease.
Mm. And when you look at the way that this disease is managed in clinics and even with different providers working together, are there any areas of potential improvement that you hope that you know that change for the better? Do you see any kind of potential for growth or change in any areas when it comes to direct patient care, or something that you wish that people would emphasize when it comes to direct patient care?
Right. Yeah, no, totally. I mean, I think you hit the nail on the head. It's such a multidisciplinary, disease that requires such a multidisciplinary approach. I know, for example, in our other diseases like lupus, like it's not uncommon that you have, a rheumatology, nephrology clinic, the patients come to these clinics and both the nephrologist and the rheumatologist are there and they're managing the lupus nephritis at once. I think there are places that do have like an inflammatory bowel disease and a rheumatology joint clinic, but it'd be great to have a lot more multidisciplinary clinics where the patient could present to the clinic and they've seen the rheumatologist and the ophthalmologist at the same time. Because otherwise, I think a lot of our patients from their one disease, end up being like full-time professional patients. Like if you look at their schedules, there's so many doctor's appointments that they have to attend. So it'd be great if there was a way, that and again, each institution is different. The resources that each institution has, is variable. But it'd be great if there was a way that we would be able to blend together, physician specialties to help to save time, energy, money for the patient.
Wonderful. Well, this has been an amazing conversation, Dr. Wright. Thank you
Thank
so
you.
much for joining us on MD Newsline Podcast.
Thank you for having me. It's been such a pleasure. Thank you.